Well, some Hoosiers who rely on Medicaid, they're struggling to maintain their coverage.
One woman who's paralyzed is sharing her experience of spending 3 months fighting to get her full coverage back. Anna Darling shares her story with us now. Anna.
Hey, good morning. Nicole Richards, she's no stranger to us here at Fox 59. We followed her recovery journey after her accident 25 years ago left her paralyzed, and we followed her again in 2013 when she battled breast cancer. This time, her fight was for her Medicaid coverage. Nicole Richards is the same as many Hoosiers. She loves her dog, Sammy.
Sammy, were you on the cameras? Yeah, you made friends?
She's a Ball State grad who has a good job working in human resources.
And I have my own house, so the past 25 years have been pretty good to me.
But she faces unique challenges every single day because of what happened in one instant 25 years ago.
Yeah, I was in a car accident when I was 17 years old. I was a senior in high school, and I was in Muncie at a Ball State gymnastics meet. And on our way home, we got into a big accident, 20 cars, and I was the only one seriously injured.
One thing that's been constant since her accident, her Medicaid coverage.
Since I was permanently disabled, they would pick up and cover everything that my health insurance through work didn't cover. So I've been on and off of it for the whole 25 years.
That coverage helped her pay for a home care agency to come out 40 hours a week. And all was normal until this past fall when she got a call from that agency.
And they called on November 1st and said I was no longer eligible. And that was, it had showed on their computers. So I called the Medicaid office and they said they were reevaluating everyone. And I needed to resubmit all of my forms and documents.
Which she did, and was told it would be a quick process. But as the weeks went by, the agency continued to tell her she still was not eligible for their services. This also meant having to pay for expensive medications, mostly out of pocket.
So it was a lot of back and forth phone calls, and no one could give me a straight answer.
Her loved ones have stepped in to help her navigate her home.
I'm grateful that I have family and friends that will help me no matter what, but I don't think that other people are as lucky as me.
She says she does everything right, including paying $187 into her Medicaid coverage every month.
If this happens to me, it's probably happening to others.
When the Consolidated Appropriations Act of 2023 ended continuous Medicaid enrollment tied to the COVID-19 emergency, Medicaid recipients were required to submit current household and income information to stay enrolled. FSSA says that unwinding period took 12 months starting in April 2023 and should have been over by November 2024 when Richards lost her coverage. The Indiana Medicaid website says it can take up to 90 days to determine eligibility when applying for coverage.
Just don't give up.
The good news is that as of this month, Nicole's full home agency hours have been approved, meaning she went more than 3 months without her full Medicaid coverage. But she wants to share her story to encourage others to be persistent and document everything.
If you don't follow through, they're not going to follow through with you right now. So just hang in there and just keep calling. Just be a good self-advocate for yourself, I guess.
A spokesperson for FSSA says they can't comment on individual members' cases due to federal regulations. We'll have links to Medicaid re-enrollment documents and the phone numbers you should call if you're having troubles with your coverage when this story is posted later today on fox59.com. Back to you guys.
Anna, thank you so much. 444.